What's going on, everyone? Welcome to the Monday edition of the Pandemic Update for Monday, May 22nd, 2023. Hopefully everyone's staying safe. If you had to take a COVID test, hopefully you have tested negative. Taking a look at India today, 473 new cases of COVID have been reported there, with 7 deaths in the last 24 hours. In Thailand, we do have more news today. More than 60 different XBB sublineages circulating in Thailand of COVID-19. Hospitalizations and deaths are rising. 226 people are on ventilators, and there have been 64 deaths in the last week. So it would appear the number of severe cases of COVID in Thailand is significantly rising. It's too soon to say if any of these new subvariants are more severe, but we can at least say that the number of severe cases there are rising relatively quickly. And look at this. Worryingly, it was also reported the number of COVID-19 inpatients with lung inflammation rose to 401 for the same period, and that 226 COVID inpatients are now on ventilators. So that is relatively concerning, and this is a story that we are going to be watching very closely. Moving on to this, Lee Shin, who is the Prime Minister of Singapore, tested positive for COVID on Sunday, May 21st, after traveling in Africa. Currently, he is 71 years old. Next story, youth suicide rates increased during the COVID-19 pandemic. Whew, that is a horrible headline. This one, we're just reading a headline. Moving on to another one. SARS-CoV-2 replication persists for weeks in lungs after symptom onset in severe COVID-19. And yes, this is 100% true. You noticed how some people have continuous coughing issues for week after week after week after they have tested positive and maybe somewhat recovered? Well, this is one of the reasons right here. Moving on to our next story. Look at this. Israel cancels mandatory quarantine for COVID-19 patients. Honestly, I did not know that they still had a mandatory quarantine there, but it is now being canceled. So if you lived in Israel, apparently if you tested positive, mandatory law, you had to quarantine. And it says here, Israel is testing positive for COVID-19 will, as of Tuesday, no longer be required to enter quarantine, the country's health ministry announced on Sunday. However, although quarantine is no longer mandatory, it is still recommended. Well, of course, if you test positive for COVID, you need to isolate yourself from other people so you don't spread it to other people. I mean, here in the United States, that's a reach, but wow, it's unbelievable that they would even have to say that they recommend you doing it. People should just know, if you have COVID, you isolate. Simple as that. Alright, moving on to some breaking news, or a developing news story, I should say. And this is the first part of it. There's 2 pieces to this, and it's not good news at all. 4 of the people who came in contact with the H5N1 bird in Brazil are now showing symptoms. So this is not good. And tests have only been taken on those people, contrary to the report that testing was carried out on all 12 people. This is from Infectious Disease Tracker, and apparently there were 12 people. Well, there's some bad news on this. This just in as I'm recording the video. It's been updated now. Breaking. The Secretary of Health in Brazil confirms that there are now 23 people under monitoring after being exposed to H5N1 bird flu. 3 suspected cases are also being investigated in the region. So this is becoming relatively serious and rather quick. And if we come down there to their next tweet, it says 2 of the suspected cases were reported previously and test results are pending. 24 new people were exposed to the virus, according to the Secretary of Health, with 1 having symptoms. And they say this explains the number given for those confused. Yeah, this is extremely bad. And I hate to say it, I've been mentioning this in bits and pieces last week, and I'm going to say it again right now. This is a ticking time bomb. H5N1. Eventually, unfortunately, Human-to-human transmission could happen. I don't know when or where it's going to happen. Could it happen soon? Could it be several years from now? I don't know. But what I do know is if this becomes human-to-human, we got a humongous problem. We see how people do not want to take COVID seriously. Guess what? If they mess around and don't take H5N1 seriously, the death rate is much higher in the cases that we have seen in humans. So this is something serious, and I stress strongly, we need to deal with this on the worldwide level. The WHO should just come out and declare an emergency on this. They really should. They should declare an emergency, even though it's not spreading among humans yet. They should just do it, because the faster we act, the faster we could get this under control and maybe do something about it. We can prevent this from going human to human. Because once it goes human to human, all hope is gone. Because, as you know, people have warped immunities from COVID. So this is something really serious that we need to look into. Alrighty, here's some more breaking news. A MERS case was found in Pakistan. So basically what MERS is Middle East Respiratory Syndrome, coronavirus, confirmed in Pakistan. Haven't seen one of these cases, and it was a 19-year-old woman who recently traveled to Saudi Arabia who has been diagnosed with the virus upon her arrival. So, yeah, and it does say she is in isolation in the hospital. So yet again, something else we have to watch. It's just, it never stops. It keeps unraveling, doesn't it? Alright. Moving on to this. More Pakistan news. Pakistan now reports its 5th monkeypox case detected within this new outbreak that's going on for 2023. So they are now up to 5 cases. Alright. Irish actor Ray Stevenson of Rome and Thor has died at 58 years old, sadly. And unfortunately, I have not seen a cause of death. It says your representatives for Stevenson told the Associated Press that he died Sunday but had no other details to share on Monday. So maybe in the coming days we'll get a cause of death. I mean, we are still owed several past deaths that we have reported on causes, and we still don't have them. So maybe one day down the line we'll get a cause of death. Alright, Walgreens. There was an upgrade to Walgreens today. Update, I should say. And it was the video that we did before this one. And as you know, if you haven't seen it, go watch it if you want to. It's a jumbled mess today. This number that says 24.1% positive this week, that is an inaccurate number. There's a lot of issues with this week's update. Some states that are red have not reported. Some that are green are actually rising. It's just a disaster. Alrighty, moving on to this day in COVID history. And on May 22nd of 2020, the Lancet publishes a large study showing that COVID-19 patients who received the anti-malaria drug hydroxychloroquine, remember this one, dies at a higher rate and experience more cardiac complications than COVID-19 patients who do not receive the drug. This study will shortly be retracted due to data misuse, but multiple other studies have since shown that hydroxychloroquine is neither harmful nor beneficial in the treatment of COVID-19. So that's this day in COVID history. Moving on to our next thing. And on this day in wastewater, as you can see here, the majority of the regions are flat. The pink region or purplish region, which is the Great Lakes, that is dropping. There is something that I do want to tell you about wastewater, and there was a tweet going on. I don't have it up here. I should have it up here, stating that wastewater in New York City area has risen by 300%. And speaking of New York City, you're going to see something about that in just a little bit here. Let's continue on here. Top variant is XBB.1.5 at 64%. And the XBB 116 variant is at 14.3%. XBB 2.3 is at 3.5%. We'll get a new update on Friday. I think it's too soon to say that the FU variant will be added. Though at some point I do expect we will see the FU variant on this data set. Alright, taking a look here at New Jersey. They changed how they do things. Maybe a little confusing to you. It was confusing to me at first. And here we go. Week ending in May 20th. And this is for deaths. It says only 2 deaths. I don't understand that whatsoever. We saw the hospital reported deaths at 6. So I'm assuming we're just only getting the lab confirmed deaths in New Jersey. And we're not getting the hospital confirmed deaths anymore. I don't know. And the cases, that's another jumbled mess within itself. I will give you a case update for tomorrow. Remember, this is a weekly summary. Hospitalizations, 155 people in the hospital, 11 people in the ventilators, and 25 people in the ICU. So they at least kept this the same. Taking a look at Philadelphia here, 709 EMS incidents for Sunday. So it was higher than Saturday, like I thought it would be. Taking a look at New York State, we do have some concerning trends here. New York State in the last 24 hours reported 268 new cases, not including reinfections or at-home tests. And the test positivity rate in the last 24 hours was up to 3.4%, and the 7-day average is now up to 2.5%. And this is relatively concerning because let's take a look at Hubbub World data, and you can see here in New York State, if we look down towards New York City and Long Island, you can see the COVID forecast is for very high level of COVID cases to continue, which means cases will likely continue to rise there. And we can take a look at the hospitalizations here, and we'll take a look at them for statewide and in New York City Metro, because unfortunately New York City Metro is on the rise. Statewide, 551 people in the hospital, 66 people in the ICU. But when we come down to New York City, look what's happening here. You can see they ended the week last week with rising hospitalizations. You can see 209 people were hospitalized, 31 people in the ICU. The previous update before that had 196 people in the hospital. So that is an increase of 13, and it's something we're going to have to watch. Tomorrow is important because we know Tuesdays and Wednesdays often have the biggest increases of the week during a rise. And when we take a look at the hospital admissions in New York City, let's see what that's doing. We can see here, yeah, they're starting to inch up slightly as well. And let's take a look at the statewide level, and you can definitely see here they are slowly inching upwards. So this is something that we have to concern ourselves with. Moving on to today's international update, and again, we're coming off of a weekend where there is a lot of weekend lag, so some of these numbers will not necessarily be accurate, but I will give you some percentages here. South Korea, cases are up 2%, deaths are down 5%. Australia, cases down 20%, and deaths are down 45%. I suspect by the end of this week we'll probably see Australia rising again, because remember, they are entering wintertime there. New Zealand, cases up 17%, deaths are up 22%. That's a pretty healthy size increase, not good to see. Philippines, cases are basically flat now, deaths are up 1%. Vietnam, cases down 18%, deaths down 60%. Then we come down here to Mexico. There seems to be a big increase in cases and deaths there. 129% increase in cases, 244% increase in deaths. And then coming down here to India, cases are down 45% and deaths are down 29%. Malaysia, cases continue to drop at 25%. However, deaths are up 33%. Hong Kong, cases are down 17% and deaths are up 14%. Thailand, this is continuing to get concerning. Thailand, cases are up 39%, deaths are up 120%. But remember, this death number here of 22 is likely underdone, because if we go back to our second story of the day, we know that 64 deaths were recorded in the last week. So that has not updated on Worldometers. It probably will in the coming days, and when it does, that percentage is going to go much higher. Alrighty, that does it for today's pandemic update. We'll have another pandemic update again tomorrow with all the latest news and data. Until I see you again tomorrow, I need you to do a couple things. If you like this, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below, hit the notification bell, and you'll know when I do future videos. And of course, test negative. Stay safe. Do safe activities. Don't do risky activities. Try and avoid everything that we talked about today. Avoid the risky scenarios. And if you're going to be around poultry and farm areas, farm animals, please be careful, because H5N1 is getting super concerning. And the rise in COVID cases in New York City, as you just saw, is really starting to get concerning. I think we are entering another wave at a bad time as we're headed into Memorial Day weekend. Alright, see you all again for another update again tomorrow. Thanks for watching. Stay safe, everyone.